Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye, a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. And I'm here today with a special guest, Dr. Karen Kaufman, a double board certified allergist, immunologist, and internal medicine physician who specializes in the care of both pediatric and adult patients. Dr. Kaufman has been recognized repeatedly as a top doctor in the greater Washington, D.C. area and has a thriving solo practice in Northern Virginia, Kaufman Allergy, Asthma, and Immunology. And today we're discussing environmental and food allergies. Welcome, Dr. Kaufman.
Thank you for having me. This is fantastic. I'm really excited to be here.
Awesome. So before we get into it, you're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugar Land, Texas. And I'm so excited you're here. If you're seeking a more convenient and proactive approach to your care, come join us. You can enroll at www.intouchprimarycare.com. And remember, you can always listen to this episode and all our other episodes on the In Touch Primary Care YouTube channel. Leave comments, subscribe, and please share. Share with someone that might need it. You never know, it may make a huge difference for them. All right, so let's get into it, Dr. Kaufman. What would you like to share about yourself personally and or professionally?
Well, I've been in medicine for quite a while now, and my career has been extremely varied through the years. My background is in military medicine, where I spent 10 years practicing both internal medicine and allergy and clinical immunology. And since then, I joined a private practice, which was a multi-specialty group after getting out of the military. And then I left that practice almost 2 years ago to open my own private practice here in Vienna, Virginia, which has been an amazing experience to serve my patients in the way that they deserve and live close to where I work, which is great because it allows me to spend more time with my loved ones, including my husband and 2 children. So it's just an absolute joy to be able to be a part of the community where I live and where I work and to serve the people here. And it's just been an absolute gift. So really excited.
Yeah, that's awesome. That's really good that you're able to live close to work. That makes a big difference too, right?
It sure does. It sure
Awesome.
does.
So someone listening may have allergies and they may not know what's causing them. They may just have symptoms and suspect maybe they're allergic to something. How would they go about figuring that out?
I think this is such an important question because the figuring it out is one of the most important parts. I would say most people who have symptoms of runny nose or congestion or postnasal drip or sneezing, it's mostly upper respiratory symptoms, are presumptive that it's allergies. And interestingly, about 25% of people with those symptoms, they actually don't have allergies, and it's a non-allergic mechanism. But because allergy treatments are so readily available at your neighborhood drugstore, that's where most people will start, is by trying to manage symptoms on their own without even maybe seeking guidance from their primary care provider, or if they may not have come to see a specialist yet. So when we see patients here in our office, and we see both children and adults, but we are evaluating patients who come in with symptoms like this, the testing for allergy is such an important part of their evaluation and subsequent management, because we want to know what it is we're treating, if it's even allergy or not. And if it's not, what type of non-allergic rhinitis is it, and how do we manage that? When it is allergy, which it is very often, we want to know what the specific allergens are, so that way we can give great practical guidance about environmental control measures that can be implemented at home, ways to target symptoms with medications at the appropriate time, as to not, just start medicines and leave people on them, right? We want to use medicines as little as we need to. But also, environmental allergies are fixable. A lot of people don't realize that. And so it is important to know specifically what those allergens are in order to move in the direction of more definitive treatment. So I think there's a lot of value in getting tested, and really the best place to do that is to see a board certified allergist immunologist. There are other places to do testing, and some people may find, tests, let's say, either by, being performed by their primary care provider, or maybe another specialist like an ear, nose, and throat specialist. And all of that stuff is okay. So getting that information is really, the start of it. But once somebody identifies, yes, they have environmental allergies, then it is important to see an allergy specialist to be able to, start working on the management portion.
Absolutely. And yeah, thank you for saying that, because I think a lot of people do just self-treat
Yeah.
and assume that they have something without really trying to figure it out. So it's good that you mentioned that. Are there any harms of not addressing a food or environmental allergy?
Yes, I mean, certainly with food allergy, that is definite risk. So when we see patients who have food problems, and I see patients with all different types of food problems, it's really important to have that assessed and evaluated, because when we're talking about immediate hypersensitivity, these are foods that individuals may ingest and react to with severe and even potentially life-threatening reactions. So that evaluation and the counseling that goes along with it, with regard to emergency preparedness, is very important, relating to immediate hypersensitivity. And these are what we think about as our primary food allergies when we think about people who have a severe reaction of what we call anaphylaxis. So certainly without an evaluation in that regard, there's definite risk. Even for other food problems, they're still important to evaluate, particularly the immunologic problems. There are food problems that are interestingly linked to environmental allergies, and these are more secondary forms of food allergy, which we refer to by the term the pollen food allergy syndrome. And sometimes symptoms can be more mild, but sometimes symptoms can still be severe in that regard as well. Even things like celiac disease, which is an autoimmune problem, where the ingestion of gluten-containing grains can cause a lot of distress and malabsorptive symptoms and problems in the gastrointestinal tract. Even other immunologic problems that we see, like eosinophilic esophagitis, which is a problem where immune cells end up abnormally present in the esophagus, and that can be driven by food and environmental allergies for that matter, and can lead to potentially, harmful obstruction of the esophagus as food that is swallowed gets impacted in the wall of the esophagus. So, for many of these immunologic problems with foods, there is potential risk in it not being evaluated. There are a lot of other food problems that many people experience that are not immunologic. And these are what we refer to by the word, using the term food intolerances.
Mhm.
And really, these are things that can be teased out at home. And really, the best way to diagnose a food intolerance is with tracking and keeping a detailed food and symptom diary. There are tons of tests. I know we're going to talk about testing, but there's tons of tests that are out there on the market that you can literally go to your neighborhood, drugstore and buy a test that's going to find out what all of your food sensitivities are. I will, let you guys know that these are tests that are evaluating things that are not related to the problem that we're trying to figure out. So they end up leading to a lot of misadventures in, elimination diets, and people sometimes even develop problems of micronutrient deficiency. So certainly, while it's important to get all of this stuff figured out, we want to do the right test for the right problem.
Right.
So that's kind of the story about foods. In the realm of environmental allergies, they can sometimes be dangerous if they're not evaluated. And sometimes where I've seen this has been in individuals who have pretty significant allergy to some of our furry animal friends. And so in the time of exposure of animals, which, and people who have allergy to animals, they may not necessarily be around them at all until they are. And sometimes we can see really severe symptoms, even of, exacerbations of asthma, which that can be dangerous. Even
Mhm.
some of our outdoor environmental allergens like pollen and mold spores, and even things like dust mites at home, they can also contribute to asthma symptoms. And when asthma is not controlled, there is significant risk.
Right.
Otherwise, I would say for the run of the mill stuff, we could, most people do start, with some over the counter medications and trying to tease it out themselves. And that's really okay. But ultimately, we want to go in the direction of getting things figured out so that way we can get them fixed.
Yes, absolutely. And yes, I think that it basically what you're saying is you need to understand what you're trying to treat in order to treat it properly. So I know a lot of times we go about it the other way. We start treating and hope it works. And then,
Right.
which is not the way to do it, because sometimes you actually make it a lot worse. So I think that's important for our listeners to hear. Okay, so what are practical tips that will be helpful for people that have food or environmental allergies? Like, what are things they can start to do now?
Sure. So I guess I'll give you a practical tip first with regard to food allergy. So, relating to food allergy, and this is really when we're talking about immediate hypersensitivity. So again, these are our food allergens that after ingestion can lead to symptoms within really seconds to minutes to maybe an hour or two. These are foods that do need to be strictly avoided. So when a patient, and often we see this in children, but when a patient is diagnosed with primary food allergy, the mainstay of treatment is going to be strict avoidance and emergency preparedness. So my first tip is, if you find out that there is a relevant allergen that's a cause of symptoms of immediate hypersensitivity, don't try to reintroduce those foods at home. Okay, do this under the supervision of your allergist immunologist only when the time is right and it is indicated, when the doctor thinks that the patient is potentially growing out of their food allergies. And we do actually do that in our office, and we call that we call that an open food challenge, but only when the time is right. So what we don't want is we don't want parents to be introducing food allergens at home without guidance. So, just to kind of circle back, mainstay of treatment is going to be strict avoidance and emergency preparedness. And so I think that's an important one to just remember with regard to food allergy. With regard to environmental allergies, I really think about, really 3 steps in management, which is going to be, do all the environmental controls that you can, which is, you need to identify what those allergens are to know what kind of environmental controls to implement. But to me, the more things we can do without taking medicine, we should at least do those, right? Those are the freebies, right? We want to get those taken care of. When we need medications, if patients are taking allergy medicines on their own that perhaps they just, went out and got over the counter, and they're not having great success in management, it is important to work with their doctor to make sure that they're on the right path to success with the appropriate treatment for the appropriate problem. So, if meds aren't fixing the problem, on your own, make sure you're working with your doctor to, to find a better solution to get symptoms under better control. And I would say the third practical tip, or the third thing that we do with regard to environmental allergies, is that, when we talk about fixing allergy, we can do this with allergen immunotherapy. And in this case, what I'm talking about is subcutaneous immunotherapy or allergy shots. And it's a method of treatment that is completely customized. So for every individual patient, they get their own customized prescription that's based on the things that they're allergic to. But our goals of therapy include not only reduction of symptoms, but also reduction in need for medications and improvement of quality of life. And so that's such an important concept, because I think a lot of patients, particularly our adult patients, they experience symptoms that they just feel like that's how it is, and that's just what they need to live with, and that's how they feel. But I think it's important to understand that everybody deserves to feel well and to live a healthy lifestyle, and to try and limit medications if we're able to. And anything we can do to help those symptoms to go away, I think is a very worthwhile endeavor. So that would be something that they can, talk to their allergy specialist about.
Great, great. So yes, those are great tips. Thank you for sharing those. Make sure not to try and reintroduce foods by yourself. It's so important to do
Without
that.
guidance, for sure.
Without guidance, yeah, that's a really important, I know sometimes parents are in a hurry to, hopefully they want their child to have grown out of it. And so they're trying little, little bits and pieces over time, hoping that, but it's better to do it under guidance, like you mentioned. And then knowing what the allergens are, and then making sure that if they're not getting better, following up with the doctor that can help you treat them. Also very important, and knowing that there is a potential cure for your symptoms if you work with an allergist. So thank you for sharing those. So let's get into your solo practice, Kaufman Allergy and Immunology. What does it offer? What are you able to offer people?
In our practice, as I mentioned, we see individuals of all ages from our small infants all the way up through our elderly population. And so we really see a full gamut of the spectrum of allergies, asthma, and immunologic disorders, which is just so fantastic because throughout our lifetimes, what our focus is with regard to problems that we have, it's different at different times in life. And so, in our youngest patients, we of course handle a lot of the evaluation management of food allergy and bad eczema. And as children get older, we sometimes will see the development of upper respiratory allergies, ocular allergies, and asthma. So we do a lot of asthma management in our office. One of the ways that we are really able to serve our patients with asthma, and this is for all of our patients ages 5 and older, is that we offer remote patient monitoring where patients can do spirometry at home, which spirometry is the name of a test where we can measure obstruction when people breathe. And so this is something that we monitor on a daily basis with our staff. And it really is able, it's a nice way that we are able to extend our clinical care outside of the 4 walls of our office. So our asthma management is awesome. I see a lot of patients with immunologic disorders, so patients with chronic sinus infections and recurrent ear infections in childhood, or even pneumonia, or an infection maybe that required recurrent rounds of antibiotics to try and, get better. Many of the time we identify that there's a reason why this happens to people, and it's due to problems with their humoral immunity or their antibodies that their immune system needs to make and then specify. And so we are able to do really great things for the evaluation and management of immunodeficiency in our practice. And, I think part of my background was that, years ago when I did my fellowship training, I did training in a very heavy immunology program because it wasn't something that was my forte. So now, as a clinician in private practice, it's something I'm very comfortable with and have a lot of experience with and can really serve those patients very well. And then I also take care of patients who have various problems of immune dysregulation, including different types of autoimmunity or immune function disorders. And so, we're really able to do the best we can to address, all of our patients and their needs, and to be able to, provide the absolute best care that they deserve. We do all sorts of testing in the office. Not only do we do regular allergy testing for environmental allergens and food allergens, but we also do patch testing, which helps us to evaluate an allergic contact dermatitis. And we do drug allergy testing as well, for example, for individuals who have had this longstanding history of penicillin allergy, in their record, and they want to know, do I still have an allergy to penicillin? It's an easy question that we can answer for patients and really, open up the doors for them to the potential for, treatment of a future infection with the most appropriate antibiotic without, broadening the spectrum too much and leading to problems of antimicrobial resistance, or potentially choosing an antibiotic that has unwanted side effects that we don't now need to choose. So, we're able to do a lot of really wonderful things from a testing standpoint. And we do treat patients here with allergen immunotherapy or allergy shots, as I've mentioned. And we treat, patients of all ages, really as young as I would say a child who's old enough to express their feelings of wellness to another person, then they're old enough, in my opinion, to start immunotherapy. But we have great success in both children and adults in really helping to, reduce those symptoms and improve that quality of life that we all hope for. So that's a really, wonderful aspect of our practice. And I guess the other thing we do is we utilize a lot of biologic therapies that are now available. We have some that have been around for, almost 2 decades, but lots of other choices in the realm of biologic therapies, probably in the last 5 or 6 years, that we can really, amplify the improvement of many clinical conditions, including asthma, atopic dermatitis, eosinophilic esophagitis, and nasal polyps. And so, we have a lot of experience, and we love to serve our patients here and try to provide for them the experience where they know that they're going to get their questions answered. They know that they're going to leave with a great explanation, and they are treated like, guests in our office home while they're here. So, so that's kind of the big picture of what happens here at Kaufman Allergy.
Yes, that sounds awesome. That sounds great. I think patients should definitely check that out, check you out. They can get a lot of value by coming to your practice. I think many unique things that you mentioned, but just even the immunology piece is huge, because I think sometimes we forget that, and that's very needed.
Absolutely.
So where can people find you?
Well, they can find me here in my office, which is located in the Washington, D.C. suburb of Vienna, Virginia. We're right in the Tyson's Corner portion of Vienna, and we have a beautiful office that's right off of the highway and very easy to find. Virtually, you may find us on our website, which is kaufmanallergy.com, and you can also find us on social media, on Facebook at Kaufman Allergy, and on Instagram at dr.kaufmanallergy.
Okay, so all those places, we're going to have those in the chat as well, so people can click on there. So if you are in the DC, Washington, DC area, go to Dr. Kaufman, okay? She can really help you with the symptoms that you're experiencing. You don't have to delay your care. You can feel better pretty quickly, so it's important. All right, so thank you for listening. That's all we have for today. Remember to subscribe and share with someone who may need it. And if you're in the Houston area and you would like to experience the peace of mind that comes with being able to reach your own doctor when you need it, come join us at In Touch Primary Care. You can enroll on our website, www.intouchprimarycare.com, and we'll love to see you. So we'll see you next week at 2:15 p.m. next Wednesday at 2:15 p.m. Bye-bye.